Hello everyone. I am Alifia Bhol, a clinical nutritionist and dietitian. Uh, I am from Mumbai and I have my own diet therapy clinic called as Nutrial. I have been practicing since few years now and I have experience of working in a gymnasium, in a hospital, in a private clinic, in a government as well as a private hospital. And now I have involved in social causes. And today I have the pleasure of being with the DBWRF team, and I'm taking over their Facebook Live today to discuss nutrition during Ramadan. Since many of us are skeptical because of this hot and humid weather, about what our body needs during Ramadan. Will we be able to sustain the long hours without food and water? And most of us have diabetics at home, so concerns about their health during fasting. So let me know if you guys have any questions, and I'm here to answer them.
Yeah. So can you tell us something about the significance and the importance of fasting during Ramadan?
Okay, so significance of fasting. First of all, we all know that fasting is one of the base of Islam, and it is scientifically proven that fasting helps in prevention and therapy of diseases, helps in detoxification, helps us to stay calm and be active overall. Also, I would like to mention that Sehri and Iftari are considered to be very important part of fasting, and some people stuff themselves with food thinking that this will help them to sustain Ramadan in a healthy way. But when we get to think about it, it was never Islam never promotes overeating during fasting. So that means our Sehri and Iftari shouldn't be loaded with food. It needs to be light because everything, the whole concept of Ramadan is being light with entertainment, light with food, light with bad deeds. So basically, what I'm trying to say is food also cannot be taken for granted during Ramadan. The concept of eating more so that we are more active throughout the day is completely wrong, and you just need to go light. If you the the correlation, if I can put it in just one line, is if the lesser you eat, the more active you stay. Now the lesser you eat can be translated in many forms. So today I'm going to tell you all what does it mean to eat less and still be healthy.
And this year Ramadan falls right in the middle of summer, which is the month of May, and it's really hot. So how can someone stay hydrated, especially during this time and during the afternoons especially?
Right. So what we do is there are certain foods, there are certain hydration drinks that one can have and prevent getting dehydrated, prevent getting dizziness, and just have a smoother day overall. So let me give hydration tips. Um, so what we can do is, firstly, it's water, right? Water is, I mean, the main element of our body, and it's the best therapy to be hydrated. Have lots of water during Sehri, after Iftari, and some things that you can add to water just to be more, uh, you know, hydrated. Uh, so we have something known as basil seeds, very commonly found in all the household. That is sabza. You can just, there's no need of transfused water, but even just adding sabza to your normal water really helps, keeps you hydrated. There is chia seeds, high in fiber, just a lot of health benefits overall. So that can be added to the water you're having. Warm water works wonders. Like we have this habit of having cold water for hydration, but it will be great if we can opt for warm water. Why? Because when we tend to drink warm water, we are able to consume more. Whereas when you have chilled water, your thirst is quenched even with the minimum quantity. So having warm water is great. One tip is start your day with warm water, end your day with warm water. This is an excellent tip for Ramadan to stay hydrated because you will consume more. Also, some fruits have a lot of water content, so that can be taken. For example, watermelon, like we all know. Apple is great. Um, then there are citrus fruits like orange, sweet lime. All these have high water content, and prefer a whole fruit rather than a fruit juice so that we are cutting down on sugar. Since we're talking about thirst, I'll just complete telling other foods that help to prevent thirst. So we all know that when any fatty food and high sugar food is consumed, you tend to feel more thirsty. That means your Sehri should not be having high fat foods and high sugar foods. That is one way of making sure that you are not going to be thirsty throughout the day. Okay, and what else for hydration? Avoid having too many fruits in Sehri because fruits do uh, make us feel thirsty very soon. So stick to, for the general population, you can stick to one fruit in Sehri, and the rest, one or two, can be had after Iftari, and that should be okay. Dates, like we know, dates are great thirst quenchers. So why not include? I mean, everybody has them for Iftari, but why not include two dates even in Sehri? That would be a good habit. And yes, warm water and sabza. I think that's covered.
And are there any other recommended dishes that you should have during your Sehri?
So talking for the average person whom I'm counting as is free from diseases, um, and is normal weight. So they can include dishes like a complex. So the Ramzan platter should look something like you have a small portion of protein, you have vegetables, you have little fruit, and you have whole grains. Okay, whole pulses. Now, what I mean by that is the lean protein can come from egg whites. I prefer telling my patients to skip chicken or mutton during Sehri. That's because our iftari is mostly having a non-vegetarian item. So we do have chicken or mutton on most of our days during iftari. So it's the best to avoid meat during your Sehri. Okay, the protein can and should come from either egg whites or there can be lentil, whole beans, pulses. Okay, there should be a small portion. When I say small portion, that is around 30 to 40 grams that I'm looking at. There can be boiled egg whites. If it's a fried egg, it should be in a minimal quantity of ghee on a non-stick pan so that you don't end up having too much fat in your diet. And like I said, it can lead to a lot of thirst. Little vegetables that can be either boiled or in a salad form, or you can just have a one bowl meal. So you have a little of, a little bit of mung sprouts, you have your grilled, sauteed, or stir fry vegetables in that bowl, along with some healthy seeds sprinkled on that. So we have sunflower seeds, melon seeds, flax seeds. These can be sprinkled and little lime juice on top, and just a bowl full of nutrition. Of course, limit the quantity. Can't have a big bowl or two bowls. And since I'm talking about the quantity, why we need to restrict the quantity is because we know there are certain digestive enzymes. Now, when we have a very heavy sehri, what happens is throughout the day you will hear some rumbling in your stomach. Why that happens is because there are certain enzymes that are constantly trying to digest food, and we don't want that. We don't want our concentration to be constantly on our digestive system. We want to be busy praying, be busy working. So if the lighter the meal, lesser the strain on the digestive system to digest that food, and you will just feel light. That's the meaning of feeling light the whole day, just not having foods that are heavy on the digestive system. So sugar and fat are heavy on the digestive system. So if you're having with something with fiber, very little protein, little protein and whole grains. Whole grains are also very slow to digest. That means it keeps you full and does not raise your blood sugar immediately. So yeah, so I'll just answer that question. So while I was saying we were just discussing on options for Sehri. So what you can do is you can take little oats along with boiled egg whites in it, put few veggies in that, sprinkle some seeds, have it as a cold porridge that is kept overnight in the fridge, or make a hot porridge, porridge and have it. Or you can do uh, fruit oats, or you can take muesli with yogurt and just on the side some egg whites, or sprouts and dahi is a combination made in heaven, okay, for your sehri. So take 2 tablespoons of sprouted moong, put 2 tablespoons of yogurt or curd in that, chopped tomatoes, cucumber, green chilies, lots of coriander, and you will feel so good throughout the day, along with the fruit on the side.
Is there any particular reason why you promote more the egg white and not the entire egg, including the yolk?
Right. So, taking the question, why egg whites and not the whole egg? I mean, whole egg is great. It's a form of complete protein. Egg is the only food that has all the amino acids present. That means it's a complete protein. So I'm not against the egg yolk, but the only thing is because we are going to be having meat high in saturated fat from the mutton or lean meat, that is chicken, in our iftari. It would just be better to avoid the yolk, uh, not because it increases cholesterol in the body, but just because it increases the total fat content of the meal. And here we're just trying to keep the total fat content of the meal to minimum. So egg yolk is best avoided because egg whites do not have fat content, but yolks do. The fat is concentrated in the egg yolk. So it would be best if you avoid the yolk. But of course, if somebody has a whole egg, a normal healthy individual, an average Indian or an average healthy individual can definitely have egg yolk.
And we also have another question saying, since summer, is gold sherbet better or lemon water?
So if I have to compare gol sherbet, that is gol pani, with lemon water, definitely gol pani. Why? Because lemon water, not everybody can have it just lime and water. There'll be people ending up adding sugar to it. Okay, so it's much better if you have the base as jaggery. Okay, also because jaggery has traces of iron, and when you squeeze, most of our gold pani is made with squeezing lime on top. So that's just enhancing the absorption of iron because we know absorption of iron is enhanced with vitamin C. So gold pani has iron, has vitamin C, whereas lemon water is only vitamin C. So definitely, gold pani is the way to go, and it's a great way. It's a great traditional way of staying hydrated, and because we do need sugar. I mean, even if people are okay with having lemon water without sugar, but we as average healthy individuals, free of diseases, we definitely need sugar. We can't let our sugars fall and feel lethargic or feel dizzy. So sugar in the form of little jaggery is absolutely okay. We don't need to restrict sugar when it comes to gold pani.
And how do you fast if you're someone who suffers from acidity, and how do you alleviate it during the fasting period?
Right. So like I said, acidity is caused because of eating heavy meals, or it is caused because of having fatty foods during Sehri, or because of eating uh, more sugar during Sehri. Once you avoid these 3 points, definitely the acidity levels are going down. Why do we feel acidity? Uh, I'm repeating what I said earlier. It's because the digestive enzymes are constantly at work trying to digest the food that we have consumed. Because of that, we have the rumbling or we have the acid reflux, and it makes us really uncomfortable. So avoid having small portions with these food groups that I said will relieve acidity. Another common observation is constipation. Okay, because why constipation? First of all, you are not hydrated. Secondly, you do not have fiber in the diet that helps for the smooth passage of stools. Thirdly, the sleep pattern is disturbed, and that really disrupts the normal digestive process. So all these leads to acidity. If taken care of the fiber and the hydration, around 80 to 90% of your acidity will be relieved. So when I say that you should have whole pulses or sprouts, that's also because they are high sources of fiber, because we are not overdoing on fruits, so we cannot term as high fiber diet if you're having one fruit. Like I said, you cannot go overboard with fruits during Sehri. That is going to increase your thirst mechanism early in the day, and we don't want that. We want our thirst to be delayed as much as possible. So when you restrict to one fruit, your fiber source is going to be either your vegetables or your whole grains, your pulses, and your sprouts. So that's one way of relieving acidity. You can add sabza, like I said, in the warm water that you drink. That will definitely give relief from the acidity that you usually observe. And staying physically active. Staying physically active does have proven benefits on acidity. If you're going to be somebody who's been fasting and just uh, you know being low on work because you think that's going to lead to thirst, you're going to experience acidity. The more you're active, the lesser acidity you experience. I'll talk about the exercises that benefit and how to accommodate exercise by not getting very tired and relieving your acidity.
And apart from acidity, I believe diabetes is also a big concern when fasting.
Sorry?
Diabetes is
Yeah.
a big concern for how do diabetic patients fast during this time?
Right. So this is something I'm really passionate to talk about when it comes to diabetes and fasting, because innumerable questions. Like I said, every house, most of the houses nowadays have at least one person suffering from diabetes. So, and most of our diabetes patients have been restricted by the doctor saying that you cannot fast. Now, the reason behind this is because the diabetics have involvement of more than one organ failure. Okay, so some of the diabetics, diabetes is just not alone diabetes. It's not just a disease of high sugars in the blood. Some of them have involvement of the heart. Some of them have involvement of the kidney. Some of them have involvement of blood pressure. Some of them have involvement of vision. Some of them have involvement of nervous system, so they get pain in the leg or the limbs. So that means diabetes is just not related to high sugars. So uh, if we are thinking that you eat less and the sugars won't rise, and that's okay, that's the therapy for diabetes, and you can fast, because we believe that sugars only rise when we eat food. So nahi khayenge and sugars won't rise and it's okay. But that's not the case. When your doctor says don't fast, just respect that fact. uh, uh, you know Tell them to adjust the dosage of your medication. The guidelines for diabetics would be, first of all, getting your insulin in check. Tell your doctor and your concerned dietitian, your qualified dietitian that you're consulting. They must be aware of the units that you're taking, and they will adjust your carbohydrate intake according to that. So people on insulin must be knowing about carb counting. The grammages of carb that can be consumed. So that will be divided between your Sehri and Iftari, and you should be okay. Let your dietitian plan the diet for you. Do not term yourself as healthy and skip the insulin, because when you skip insulin in the Sehri, thinking that I'm not going to eat, so I better skip the insulin, there are chances of diabetics who are on insulin or on OHDs going into complications like hypoglycemia, hyperglycemia, thrombosis, or diabetic ketoacidosis. In simple terms, what I mean is the pancreas and the liver is still going to work on raising your blood sugar levels, whether you have had food throughout the day or not. Okay, so there is glucose production in the body, irrespective of whether you've had uh, food. So see to it your OHDs, that is your oral hypoglycemic drugs, and insulin dosage is adjusted in concern with the doctor and the qualified dietitian. Let the dietitian plan a diet for you. As long as tips from me is concerned, the diabetic should have a protein rich diet. Now, when I said about an average individual, we were not looking at a very high protein diet, but when it comes to a patient suffering from diabetes, they must have a diet, a Sehri and Iftari, which is higher in protein than a normal individual. Why is that? Because carbohydrate is broken down into sugars, and it gives the diabetes a spike in the blood sugar levels. We don't want that spike. We want the blunting effect. That means we want the sugars to be normal throughout the day. Protein helps to give that blunting effect. So our diabetics should have a high protein diet. And they must be hydrated, because like we know, the symptom of diabetes is frequent urination, it is increased hunger, it is increased thirst. So all these symptoms need to be taken care of, right? Also, diabetes patient must check their blood sugar levels. It is a common myth that the fast breaks when you check blood, or you test blood sugar levels. Well, your phase fast does not break, and even if you prick yourself, that's okay. You do not break your fast with it. So blood glucose monitoring is very, very important. A diabetic must do that at least twice a day. At 2 sugar readings, the blood fast should break immediately. That is, if your sugars fall down below 70 mg per dl, or if your sugars rise above 300 mg per dl. That is a situation, that is a condition when you must break your fast and give immediate attention to getting your blood sugars, at level.
We also have a question from Zena Butwala. Her husband has ulcer problems during fasting. So what can he have?
Okay, so yeah, this is very common. Now, ulcers is because of constipation, or there is a previous history of gastric ulcers, stomach ulcers. Okay, the main nutritional advice is increasing fiber. Why? Because fiber helps for smooth evacuation of stools. It helps for the smooth passage of stools, and fiber holds water. Okay, so the water is absorbed and helps for smooth formation of stools. So this is all related to the digestive tract. Now, fiber also are of two types. There is soluble fiber and there is insoluble fiber. Both important. Both have their own roles in preventing constipation and indirectly preventing ulcers. So during fasting, what he can take. So what he can take is, let him have 2 fruits, let him have a bowl of vegetables, and as your carb source, you can give him oats with sprouts, or oats with yogurt, or avoid muesli. Okay, no, I'm trying to keep the processed foods minimum. Or you can, give him a bajra roti along with a bowl of green leafy vegetables. That will work wonders in ulcers. Both are, bajra is high in fiber, complex source of carbohydrate. Green leafy is rich in fiber, and he's got his vegetables covered, and he's got his fruit covered, and let him be extremely hydrated, so that the ulcers don't, there's no further distortion of his villi in the intestine. And so let him be hydrated. At least finish 2 liters of water during Sehri, 2 liters after breaking the fast, and throughout the night he can have 1 liter. So 5 liters is covered there, and that should help in his ulcers. Also, there is, ulcers give us a lot of reflux. That is, you feel the food is coming up to your throat. That's another symptom of ulcers. So let him have chas. Let him have, if he's normal weight, he can have lassi as well. So curd and sugar, let him have that. Gold pani is okay. There is something known as alkaline ash effect. So acidity or ulcers does not mean you cannot have acidic foods. He can still have lemon water. He can have coconut water, that is soothing to the system, and he might feel better with his ulcers issue during fasting.
And are there any other common problems that concerns that people have when fasting, especially in terms of health?
Right. So the common problems that people come up with is tiredness, extreme fatigue, and experiencing low hemoglobin levels, or sometimes the thyroid gets aggravated. And I think the best solution I can offer to this is get yourself a routine body checkup done before Ramadan. Okay, now why should one do it is because you are best aware of your health condition. You and your doctor can decide on taking adequate precautions, and you do not blame the fast for something that you discovered during Ramadan. So we often have a habit that because I was fasting, my sugars went up, or my sugars went down, or I fainted. Well, do a body routine checkup. Do your LFT, do your RFT, do your fasting, PP. Most of us are pre-diabetic nowadays. So if you know your sugars are on the higher side, and you will be at a disadvantage of getting dehydrated faster than a normal individual. So you can take necessary precautions. You will be more conscious of your water intake, of your fluid intake, of your fiber intake. I mean, how many of us are conscious about the fiber that we consume? So this way, when we are, when we do a routine body checkup and we are aware of it, so we will see to it that we're taking adequate fiber and protein. We miss out on protein, thinking that at night we are having non-veg, and we avoid having protein in the Sehri. Well, that's true. We do not need to go overboard with our protein. But like I said, protein sources like sprouts, like rajma, uh, uh, lentils, beans, peas, all these sources of protein are great, and they must not be avoided. Uh, Also, I said vegetables should be taken in the steamed form because it's not possible for us to make a lot of dishes. We either have one dish ready and that the family can consume. But when we talk about vegetables, in case you don't have steamed veggies ready or there's no salad, you can also make a green leafy vegetable or just a green vegetable, on the side. And that is also a good idea. You don't need to just have salad. There can be a vegetable eaten with fulkas along with boiled egg. So you can skip the oats. It's not that oats is the best way. Oats is just instant and the least processed cereal available in the market as compared to cornflakes or muesli. That's why oats. But if oats can be skipped and you can take broken wheat that is known as lapsi or thuli, that can be made in a khichdi form or in a porridge form, and it can be had. There's absolutely no problem in that. Or there can be a jawar roti, bajra roti. Not necessary. You don't have to remove time to make them early in the morning. You can make it a day before or at night, store it, reheat it, and have it with yogurt, have it with a green vegetable that you've made, and that is also a superb idea, and there's no restriction for that as well. So if yeah, any tips for school going children since they're often in the sun and have high activity? They get hungry and thirsty too soon and crave for high fat foods or sugar rich drinks. Please suggest tips. Okay, so this is for school going children who are in the sun, and right. So I'm guessing this time Ramzan is not following with working school, so hopefully it shouldn't interfere. But then we have our kids who are in higher classes running for classes or having sport activities, and if they're fasting, I know how difficult it is for them to stay active. So what they can do is make them, and I know they wouldn't like the traditional way of eating. They wouldn't want to have a green leafy vegetable with a roti. So how do you manage their fiber and how do you keep them full without giving in to their demand of sugar and high fat foods? So what you can do is give them smoothies, make them juices. This is not recommended for adults, but definitely the guidelines are different from children, because when you compare adults and children, the activity level differs. So what you do for kids is make them smoothies. By smoothies, I mean take curd and grind it with some kind of fruit and put some healthy seeds. And you can use avoid sugar. That is going to make them feel more thirsty. So use some kind of sugar substitute like organic jaggery, or there is stevia powder. It's not for lifetime, it's just during Ramadan. So you can definitely look for that. And give them curd. They need curd. It will be the best medium because curd is also a great medium for a healthy gut microflora. So try including a lot of low fat yogurt or Greek yogurt or just normal unsweetened curd for the kids. And for them, even, for kids, even sandwiches are not bad. Like we do restrict bread for adults, but as long as children are eating an egg sandwich, it's completely okay. There is bread which is processed, it's fine. The other healthy food groups will be included. So make them an egg sandwich, give them eggs along with vegetables. Apply little butter, it's okay. If you can skip the butter and add cheese, that's even better. So make them a nice egg cheese sandwich in the Sehri, and they will love to have it with a glass of, a fruit smoothie, and give them a handful of nuts. They'll be quite active. They'll not feel tired. They'll not feel sleepy during studying or during their classes or school. If some children do have their school, and nuts are going to be in, storehouse of energy. So the nuts are going to help them during running, during sport activities, or if they have to play football during the scorching heat. The nuts, the juices, the smoothies, the curd, all these are going to help them during that time. So so that way kids' needs can be taken care of. And including for them, the best thing is just including all the food groups, uh, vegetables, fruits, fluids, chapatis, even rice. Like make them a nice pulao where you have your beans, you have your rice, you have a vegetable group. You can put chopped paneer or grated paneer in it. So this healthy pulao can also be given to kids. It's great for them to sustain activity throughout the day and not get tired during studying, not feel very sleepy or dehydrated. And a one bowl meal wherein you have all your food groups, that is the best thing you can give to kids. Give them a fruit plate. Instead of giving them one fruit, give a fruit plate to children. The reason for that is when you have small quantities of different fruits, they're going to benefit from different vitamins and minerals that's present. So don't just give them one fruit. Sorry, you can offer around 2 to 3 types of fruits, even if it's 2 slices. They're not going to finish it. So 2 slices and a mixed fruit plate or a fruit bowl. Put a little dressing of yogurt, 1 teaspoon of honey, and they're going to like eating that fruit bowl. So suppose you have an egg sandwich, either with a smoothie or a fruit bowl that is dressed with yogurt and honey. They are going to pretty much enjoy it and not force you to have something fried. Make them understand if they're going to have fried food. This is even for adults. They are going to feel thirsty very fast, and the energy is not going to sustain the whole day. Like I said, we need slow energy releasing foods, and fried foods don't offer that. Neither do high sugar foods. So let them know that elder kids do understand, and they will learn with experience. So the day they eat a lot of fried foods and go, they're not going to feel very good. But the day they're going to eat healthy meal, a healthy meal, they're going to see the difference. And they also, kids learn by example. So if adults in the family are doing that, kids will definitely want to follow them. But if you as an adult are eating something that's high in sugar or high in fat, they're going to not listen to you because you force them to have a healthy meal. They're going to love to eat what their adults are eating. So be a role model, eat healthy. Even if you've not done that previously, now start doing it. Start eating healthy so the kids, they will follow by example, and they will want to eat, and they will want to know what their mom eats and is doing so much work throughout the day. So let them learn by example instead of forcing them to eat. And treat them once in a while. uh, by treat, I mean explain to them that if they're craving for something sugary, let them not have it in Sehri. Tell them you will give them this thing but during their iftari or after the evening namaz, when they come back home, you will definitely give them that food, and they will listen to you. They will not force you to have it in Sehri. Tell them that same thing that they want in Sehri, you will give them in iftari. And even if they understand this logic that anything which is not the healthiest of things can be eaten after breaking the fast and not in the morning, that's still a win situation.
So, Dr. Lekia, we spoke about children and their active lifestyle, but what about adults who work out and who are into fitness?
Right. So, looking at Ramadan and exercise or just being fit, a lot of us are skeptical about uh, what kind of exercises we can do so that we do not end up feeling thirsty or overtly tired. Or some even have the doubt, can we exercise during fast? So the answer to this is definitely, you can definitely exercise during fasting, during Ramadan. And so the one who are at into fitness and are into some kind of fitness level, that is beginners, moderate, or advanced. For them, during fasting, advanced level of exercise is definitely not recommended. Around 130 to 140 beats per minute cardio is fine. It's safe. Even that you don't have to do daily. Even if you've covered it 3 to 4 times a week, it's good enough for the whole week. You don't need to do that at that range I'm talking. But for the ones who are into lighter exercises or doing it for a healthy lifestyle, and diabetics who are doing it for insulin sensitivity, and they must, I mean, they should. So what you can do is you can go for a walk, go, not briskly, go for a light walk, and if brisk walk, then great. The best time would be just before breaking your fast. Why? Because even if you come back quite thirsty, you are going to break your fast. You're not going to be thinking about it the whole day that I want to drink water and this is the time I just want to break my fast and end it. We don't want to do that. In fact, we want our exercise to keep us, it's like a feel good factor. It helps us even mentally, not just physically. So the best way for working women, or for women at home, taking care of home, or men, just walking is a part of the healthy lifestyle. Walk before your evening prayer. So if you have time, go for a walk that time. Come back, rest, change, and go for your prayers. Now, if you are working and you do not get time before prayers, you're somebody who comes back from office and rushes for your prayers in the evening. What you can do is either you go for your walk early morning, if that's possible, or before office. Okay, you can remove 30 minutes from your schedule for that. Go for a walk, come back, or during office hours. If you have the privilege of taking a break, take a 30 minutes break in your premise, go walk, do your steps for some time and walk, and you can come back. No need to skip, no need to jog, but walking definitely. It is a part of your day during Ramadan, and it may not be stopped. So if you're somebody who gets very tired, do it just before evening prayers. And if you're somebody who is quite dedicated towards health and fitness, then you can walk at any time of the day. After breaking the fast, you can set a schedule of going and taking a stroll in your society with your kids, with your spouse. Just go and take a walk daily for 30 minutes. That's also fine. That is definitely considered a part of your day and a part of exercise. So walk. That's the kind of activity you can include during your Ramadan day without getting very tired. If somebody is into weight training, reduce your number of days. Okay, so instead of doing weight training for four days a week, do it only for 2 days a week. That's the limit you can touch upon. And cross trainer is fine for 10 minutes. Treadmill is fine for 10 minutes. And do your body weight cardio. So use your body weight. So what we call as functional training, you can do that. That's great. You don't have time to go down, do it at home. Do functional training at home. and that will also help you to increase your BMR rate, because we know BMR rate is increased by two factors. One is eating regularly, and second is indulging in daily exercise. Now during Ramadan, we don't have regular meals, nor do we have regular exercise. So the BMR rate goes down. That means we are burning fewer calories than we do pre and post Ramadan. So to stay healthy, we can't increase meals during the day, but we can definitely increase BMR by indulging in some kind of activity. So either walking or functional training, or at home, yoga doesn't require you to feel to get tired very easily. So why not continue with your yoga exercises? uh, Power yoga is not needed nor recommended, but yoga, just breathing, helps you to calm down, takes care of your acidity, relieves you of stress, and that's what Ramadan is all about. Just freeing your mind of all the junk, of all the negativity that's around you, feeling happy, feeling positive, devoting your time towards God, and praying. So yoga is a great stress buster, and yoga does keep you flexible and will increase your BMR rate. So yoga can also be looked at. What suggestions for someone who has recently recovered from an illness and is still quite weak? What to eat to keep the energy levels up during Rosa? Okay, now there hasn't been the kind of illness specified here, so quite weak. So let's consider this illness to be either something related to an organ or just an infection that the person has recovered from. So that's the illness we are looking at. To stay to avoid weakness. Okay. So what they can have is energy levels up. Can energy levels up go only by eating a healthy meal? Okay, a balanced diet. And like I said, a balanced diet has all these food groups in limited quantities. Just because a person is recovering from an illness does not mean you pile them up with protein, because protein is definitely what our cells are made up of. And most of our health professionals will comment by saying give more protein because it helps to build immunity. But again, going overboard with protein is not going to help. They need the person who's this patient trying to recover from an illness, or trying to recover from weakness, or trying to recover from an infection, will need a lot of other groups, and not just the diet concentrated not just on protein. So give them vegetables. See to it, because it's an illness, see to it there aren't a lot of raw vegetables going in. Give them everything that's cooked. That helps in recovery of an illness. So let them have steamed, grilled, boiled meals, and again fluid, fiber. This just helps everybody overall. And during ulcers, I missed this point, they must not have a lot of raw vegetables. So if they can if they are okay with it and it does not cause symptoms or aggravation of ulcers, it's absolutely okay. But even patient with ulcers or recovering from an illness, the best way to give fruits is stewed fruits. You can stew an apple and give them, or cooked vegetables, everything, nothing raw, everything cooked. And for recovering from an illness, also the meal should be light on the stomach. You can sometimes, giving sprouts or whole pulses, it does cause bloating, especially for people who are recovering from an illness. For a normal individual, it shouldn't be a problem because that's an early meal we are doing and it's digested. But people who are recovering from an illness and they have low immunity and low strength and digestive issues, so such people should be given something that's low on digestion. So what a person recovering from an illness can have is give them khichdi. Give them a soft cooked vegetable khichdi in their sehri, a small bowl along with a medium sized bowl of curd. That is going to help them fight that illness, recover from that illness, build on their immunity. And you give them a stewed fruit. Uh, Also give them something to stay hydrated. So give them buttermilk, or make them a milkshake using milk and fruit. No need to add sugar. Such things, or give them oats khichdi. So if rice needs to be avoided, give them, in a pressure cooker, put oats, put moong dal, put your chopped veggies, and you just need to pressure cook it for 5 minutes. That can be done at night or during the day, whenever. And that one bowl meal is great for a person recovering from an illness. Put some green leafy into that, and that's great. Give them warm water. Tell them not to have a lot of cold or chilled water, and let them have warm water in the day. I mean, early morning or after iftari, before sleeping. So warm water works wonders for people recovering from an illness, and of definitely no outside food. We are looking at hygiene and hygiene levels and low immunity levels for this patient recovering from an illness. So no outside food, no packaged foods. Let the food be as natural and as much made at home. That's going to help them.
So since we're talking about, how to prepare your food and, with the focus on healthy home cooked food, what are, the iftari meal is generally a little heavy. So what are kind of healthy substitutes that people can use for very popular dishes?
Okay, you mean post Ramzan?
Yeah. Or even while breaking your fast.
Okay, so the popular, I'm glad now there is no trend of consuming those dishes which were fried and high in sugar. So I think most of us have already are already not into that trend of consuming fried foods or the traditional kebabs and the cutlets and the patties that we were having initially. But if I have to substitute still for some reason, if the person is carrying food to the mosque or breaking the fast at home and engaging in some kind of traditional dish, what substitutes I can provide is, so suppose you have made a samosa. Okay, I wouldn't recommend breaking your fast with our traditional deep fried samosas. But if at all you have made it for some reason, and if it's made once in a while, the best substitute is you can air fry them. Avoid deep frying and air fry them. It really works. I'm not just talking about cutting down calories, but it's so easy on your digestive system. You've One samosa gives you around 8 grams of oil, and since I was talking throughout about a low fat diet, why would you want to have those 8 grams of fat coming from just one samosa? Imagine we can have 3 to 4 samosas without even blinking an eye. It does not fill us so fast. So if your deep fried samosas are air fried, you have saved quite a lot of oil, and that's one swap you can do. Also the filling, we are instead of a high fat meat, that is your red meat, switch to uh, filling your samosas, stuffing your samosas with moong dal. Little of chicken keema can be taken. So instead of mutton keema, substitute it with chicken keema. Put spring onions. Put a green leafy vegetable, and now you can put flax seeds in the samosa filling, and or sesame. You don't even come to know there are these healthy seeds, and you get the benefit. It's high fiber. So even if once in a while you want to have samosa which is maida, but you have your fiber coming from the stuffing, so that's a healthy swap. The another traditional thing during Ramadan that we have is uh, maybe uh, I guess it's hariro, that is milk with a lot of nuts. So that what healthy swap you can do is, instead of making it in buffalo's milk, make it in cow's milk. Again, cow's milk is a part of a low fat diet, so it does make a difference. And do not roast your dry fruits in ghee. Just boil your milk, put your nuts in it, put little sugar if it's needed, and that's the harira you can drink. You don't need to. So you are devoiding your harira of ghee, and you're devoiding of your harira of buffalo's milk. So that's a healthy swap. Okay, also use a lot of almonds, walnuts rather than pistachios or kajus in your drink, food, whatever. Almonds and walnuts are great, so that can be used. And dates can be used to sweeten some traditional sweet dish that you're making. So use dates, or apricot paste. If if you have apricots at home, make a paste out of it. Use that in your traditional iftari sweet if you're having something that you're doing since years and you do not want to stop them. But at least the sugar content can be swapped to either mashed dates at home or to mashed apricots. We all have nuts at home, especially during Ramadan. So that's a healthy swap. Or cutlets can be made out of chicken keema instead of mutton, and we put bread as a softening agent, so that can be avoided. And use mashed cauliflower instead of the bread slice that usually our fried foods have. So cauliflower gives a great taste, and it smoothens our patties or cutlets. That can be done. Definitely, another healthy swap is avoiding carbonated drinks. So no colas, no Pepsis, no masala sodas. Trust me, your chas will have the same effect as your masala soda. So swap your masala. We late nights going out with friends and indulging in a particular carbonated beverage. Try reducing it. See the good effect after you completely stop a carbonated beverage, because it's going to be hot and we all are going to crave to go out and drink something. But trust me, if you have a glass of chas at the peak of your thirst, it's going to be even better and more thirst quenching than a glass of soda. So try doing that. It's all about going slow and steady. The first 2 days might not be easy, but once you get into the routine, you're never going to look back. You're going to love how you feel. Just that bowl of moong and curd is going to be, uh, so acceptable to the body through in this heat, and you're going to feel light, and you're going to feel good that you did something to nourish your body rather than just think of it that you need to fast and I ate whatever came in my way. So just because Ramzan is all about thanking for Allah's blessings, and the biggest blessing we have is our body. You need to nourish yourself just to be thankful for the day for the way you've been born, for the way you have been kept healthy by God's grace. And the best way to thank Allah, the best way to uh, praying diligently is by being healthy. So do not take your diet for granted. Do not be lazy about it. Invest 5 minutes more, but have a salad or a fruit, or invest 5 minutes more in making a healthy drink for the family. Do not give tang to your child. Just take out 2 more minutes and give them lassi, give them a smoothie made out of curd. So just these small changes are going to keep you feeling good about Ramadan in general and about yourself.
Thank you so much, Dr. Alifia. Is there anything else you would like to add?
No, I think I've pretty much got everything covered. But just generally, if people with kidney stones, with anemia, with thyroid, see to it you get yourself checked before Ramadan and get your drug dose adjusted, because there are going to be symptoms of hypoglycemia, weakness, dizziness, and like I've already given the guidelines for diabetics experiencing that. But even people with other health conditions or health issues must get themselves checked, get your dose adjusted, and keep testing yourself, whether it's BP, whether it's your sugar level, whether it's a blood test. Keep checking it, and self-monitoring. Ramzan is all about self-monitoring, because we do not invest time and go to a doctor between Ramadan because of our time issues, because we have so many commitments. So so at least before Ramadan, get yourself checked, get your dose adjusted, and include, if you're a low hemoglobin patient, see to it you are on a tablet of iron, folic acid. If you have low calcium and vitamin D levels, see to it you are taking that. Make sure you have everything ready when it comes to health, and just not food. Our vitamins and minerals are an important part of our diet. So if you are on any of those tablets, see to it you are taking them religiously, and consult with your doctor, consult with a qualified dietitian, understand the importance of that. Get a personalized diet plan. One size fits all will never work in Ramzan. So please get yourself a personalized diet plan, and inshallah it will get you covered for Ramadan.